Breast augmentation is a very commonly performed cosmetic procedure, and capsular contracture is the most common complication for revision breast surgery. Hi everyone, I am Dr. Anshu Mishra. I am a cosmetic and plastic surgeon, and today I will be talking to you about the most common complication following breast implant surgery, that is capsular contracture. So what exactly is the capsular contracture? Whenever an implant is placed in the body tries to wall it off as it's a foreign substance, and there is a reaction due to which a thin layer of tissue is formed around the implant, which is known as capsule. Normally, this capsule is soft and very supple, but in some individuals, if this scar tissue or this capsule becomes very hard, it can lead to conditions like asymmetry, malposition of the implant, and even pain and tenderness. So I would like to say that capsule is a normal reaction of the body to the implant, but if it's become very thick and tight, it can lead to clinical problems. So there are basically 4 grades of capsular contracture. In grade 1, the capsule is going to be soft and supple. In grade 2, it will be a little firm, but it will not cause any problems. Whereas in grade 3 and 4, the capsule surrounding the implant becomes thick, which is going to constrict the implant. It will lead to the distortion of the breast as well as maybe associated with pain. So the next question is that when can I develop capsular contracture following the breast implant procedure? Well, this can happen at any point of time after the procedure, but it is generally seen that mostly it can develop in the initial 2 years following the breast implant surgery. So after understanding what exactly is capsular contracture, the next question is that what is the cause for this capsular contracture? So the most common cause that has been described is the formation of a biofilm around the implant. So biofilm means that there is a very low-grade infection which is happening around the implant, and in an attempt to eliminate that infection, the body is trying to produce a reaction due to which a capsule is formed around the implant, which gradually thickens with time. So this is a low-grade infection which is not going to cause any redness or any pus formation, but it would lead to a thicker capsule formation. So how can one prevent the formation of this capsule contracture? There are certain protocol or certain important points that one has to take care while the implant is being placed. So as a plastic surgeon, there are certain steps that we all follow to prevent the incidence of capsular contracture. So it begins with minimizing the rate of infection, as the most common cause I've already cited is the formation of a biofilm. So all the steps are taken before the surgery, during the surgery, and after the surgery to prevent any kind of low-grade infection. So before the surgery, pre-operative antibiotic is given. During the surgery, the entire area, the incision and the surrounding skin is sterilized properly. Now it is also seen that if the incision is given peri-areola, as we all know that there are 3 basic incisions through which the implant can be placed. One is the inframammary, that is in the groove of the breast. The other is peri-areolar, that is around the areola, and the other is in the underarm area. So it is seen that if the implant is being placed using a peri-areolar incision, the chances of bacterial infection can increase because in the areola there are milk ducts which can harbor some bacteria which might get exposed while one is attempting to put an implant through a peri-areolar incision. So it is seen that the inframammary incision, or the incision which is given in the groove of the breast, leads to the less exposure of the bacteria. So another important thing to prevent the infection is not to expose the breast implant in the too much in the OT. So for this, whenever the pocket has been created, the implant is opened, and then with the no touch technique, that is, we use the Keller funnel to place the implant into the pocket so that it doesn't touch the surrounding skin, which might have some bacteria. So all the precautions are taken intraoperatively to prevent any kind of low-grade infection. So if you have any kind of asymmetry, hardening and distortion of the breast associated with pain, you can consult your plastic surgeon and you can rule out the possibility of the capsular contracture. Coming on to the treatment of capsular contracture, it requires a revision surgery wherein the capsule surrounding the breast implant is removed, which is known as capsulectomy, and the new implants are placed. I hope this video would be helpful to know what exactly capsular contracture is. Thank you.